Bismillah ar-Rahman ar-Rahim. The ear is the organ for hearing. The anatomy of the ear. The ear is divided into first, the external ear consists of pinna or the auricle and external auditory meatus. Second, middle ear consists of eardrum or the tympanic membrane, Ossicles, and Eustachian Tube. 3. Inner ear consists of Cochlea, vestibule, and semicircular canal. The auricle is an oval cartilage attached to the side of the skull by anterior and posterior auricular ligaments. The skin is attached to the underlying perichondrium and prolonged inward into the external auditory meatus as far as to the tympanic membrane. The cartilage is prolonged inward to be continuous with the external one-third of the external auditory meatus. The auricular muscle, both extrinsic and intrinsic muscle, which are supplied by the facial nerve. The vessels of the auricle, posterior auricular and superficial temporal vessels. Nerves, the greater auricular nerve, branch of the cervical plexus, innervates the skin of the auricle. Auriculotemporal nerve, branch of the mandibular nerve, innervates the skin of the auricle and external auditory meatus. Branches of the facial and the vagus nerve innervate the deeper aspect of the auricle and external auditory meatus. The external auditory meatus. Its lateral one-third is cartilaginous and directed upward and backward as it goes medial. Its medial two-thirds is bony and directed downward and forward as it goes medially. The narrowest part of the canal is the isthmus, which is the junction between its two parts. The external auditory meatus is bounded anteriorly by the temporomandibular joint and parotid gland, posteriorly by the mastoid process. The skin of the cartilaginous part contains hair with sebaceous and cernulous glands which secrete the earwax. The vessels of the external auditory meatus, posterior auricular, superficial temporal, and deep auricular vessels. Nerves of the external auditory meatus, auriculotemporal branch of the mandibular nerve and auricular branch of the vagus nerve. The lymphatic drainage of the external ear is to the superficial parotid, mastoid, superficial cervical, and upper deep cervical lymph nodes. Functions of the external ear. First, sound waves is channeled into external auditory meatus by the auricle. Second, the hairs and the wax provide a sticky barrier that prevent the entrance of the foreign bodies. Tympanic membrane, a nearly oval membrane set in a cone-like shape whose concavity faces outward and its most concave point is its center, called umbo. The tympanic membrane is semi-transparent, pearly gray in color, and it is obliquely placed, facing downward, forward, and lateral. It's concave laterally. The tympanic membrane is composed of 3 layers. First, the outer layer of modified skin continuous with that of the external auditory meatus. The second, inner layer of the mucous membrane continuous with that of the middle ear. The third, intermediate fibrous layer formed of circular and radial fibers, which is responsible for the strength of the membrane. The upper border of the membrane lacks of the intermediate layer, so it is lax and called pars flaccid. The rest of the membrane is called pars tense. The handle of the meatus bone is fused with the upper part of the membrane. Applied anatomy of the tympanic membrane. In order to strengthen the external auditory meatus in examination of the ear, it should be pulled upward, backward, and laterally in adult, and downward, backward, and laterally in children. Normal tympanic membrane is semi-transparent and pearly gray with a cone of light in its anterior-inferior part. A diseased membrane loses its shiny appearance and cone of light. The middle ear is a small 6-walled cavity in the temporal bone where the sound waves are converted into mechanical waves. The cavity communicates anteriorly with nasopharynx by the Eustachian tube and posteriorly with the mastoid air cells, and their mucosal lining is continuous with each other. Parts of tympanic cavity. A. Epitympanium, the part of the cavity which extends above the level of the tympanic membrane. B. Mesotympanium, the part of the cavity opposite to the tympanic membrane. Hypotympanium, the part below the level of the tympanic membranes. Contains 1 nerve, Corti tympani, 2 muscles, tensor tympani, and stapedius muscles. 3 bones, incus, malleus, stapedius bones. Ossicles of the middle ear. There are 3 ossicles articulating together from the lateral to medial: malleus, incus, and stapes. The malleus is fixed to the tympanic membrane, while stapes is fixed at the oval window. The incus in between. The stapedius muscle is inserted into the neck of the stapes and is supplied by the facial nerve. This picture shows the parts of the malleus, incus, stapes bones. Walls of the middle ear. The roof of the tympanic cavity is formed by the thin plate of tegmen tympani, which separates the ear from the cranial cavity. The floor of the middle ear. The floor of the middle ear separates the ear from the jugular fossa. It is perforated by the tympanic branch of the glossopharyngeal nerve. The lateral wall It is formed by the tympanic membrane. Anterior wall. Its upper part consists of two canals, one above the other, as following. Upper canals loaded the tensor tympani muscle. Lower canals is the bony part of the auditory tube. Its lower part is related to the carotid canal, which loads the internal carotid artery. Eustachian tube. The Eustachian tube connects the anterior wall of the middle ear with the nasopharynx. The Eustachian tube also operates like a valve which opens during swallowing and yawing to equal pressure in middle ear. The Eustachian tube is shorter, wider, and more horizontal in children. Eustachian tube is a route for pathogens to travel from the nose and throat to ear, causing otitis media. Medial wall separates the middle ear from the internal ear and shows the following feature. First, the promontory of the internal ear is a bulge produced by the first coil of the cochlea. Second, the oval window is an oval opening above and behind the promontory. It is closed by the footplate of stapes bone. 3. The round window is rounded opening below and behind the promontory. It is closed by the secondary tympanic membrane. 4. The horizontal part of the facial canal above the oval window. And 5th, the prominence of the lateral semicircular canal, sometimes seen as a ridge above the facial canal. Posterior wall shows the following features. First, the upper part of the posterior wall is open to the mastoid antrum. Second, fossa iniquidus lies below the opening of the mastoid antrum. It loads the short process of the incus. 3. The vertical part of the facial canal lies medially in the posterior wall. 4th, the pyramidal eminence projects from the posterior wall in front of the facial canal, whose wall gives rise to the stapedius muscle. The stapedius muscle contraction tilts the footplate of the stapes, resulting in damping of its effect on the internal ears. This picture shows two tiny muscles of the tympanic cavity, tensor tympani and stapedius muscles. This picture shows the structures of the middle ear, blood supply and the nerve supply of the middle ear. Arteries of the middle ear. First, the anterior tympanic branch from the maxillary artery. Second, stylomastoid artery from the posterior auricular artery. 3. The superior tympanic branch from the middle meningeal artery. 4th, the tympanic branch from the internal carotid artery. The veins drain to the superior petrosal sinus and pterygoid plexus. Nerve supply of the tympanic cavity, deep surface of the tympanic membrane, and mastoid air cells are supplied by the tympanic plexus formed by the contribution of the first, the tympanic branch of the glossopharyngeal nerve, second, cortico-tympanic branches of the carotid sympathetic plexus. Nerves in the middle ear. First, the facial nerve has a part of its course in the medial and posterior walls. Corti tympani traverse the tympanic cavity between its bones. Applied anatomy. Communication between the nasopharynx and middle ear result in a transmission of the infection from the nose and pharynx to the ear, resulting in otitis media, which complicates children infections more than adults due to the shape of the tubes and possibility of associated adenoids. Communication between the middle ear and the mastoid ear cells result in transmission of the infection from the middle ear to the mastoid, resulting in acute or chronic mastoiditis. Internal ear lies in the vitreous part of the temporal bone between middle ear and the bottom of the internal auditory meatus. It is composed of the bony labyrinth and membranous labyrinth inside the bony labyrinth. The bony labyrinth is filled with perilymph. It comprises the vestibule, cochlea, and 3 semicircular canals: superior or anterior, posterior, and lateral. Vestibule has the following relations: anteriorly cochlea, posteriorly semicircular canal, laterally oval window, medially bottom of the internal auditory meatus, which is perforated by the vestibulocochlear and facial nerves. Membranous labyrinth is composed of 2 sacs, auricle and saccule, and cochlear duct, and 3 semicircular ducts, which are all filled with fluid named endolymph. Cochlea. The cochlea resembles a snail shell and spiral for about 2.5 turns around a bony column. Within the cochlea are 3 canals: scala vestibule, scala tympani, and scala media. The membranous labyrinth. These channels contain the sensory organs of the hearing and equilibrium swimming in the endolymph. The sensory organ of cochlear duct is the spiral organ of Corti. The sensory organ of the semicircular canal is the crista, and the sensory organ of the auricle and saccule is the macula. The specialized cells in each sensory organ are the hair cells. This picture shows the organ of Corti, the end organ of hearing, with its structures. This picture shows cochlear hair cells. These tiny hairs bend because of the vibrations caused by the sound waves. Blood supply of the internal ear. Arteries of the labyrinth. The main artery is the labyrinth branch of the basilar artery. The second, the stylomastoid branch of posterior auricular artery, supplies some of the blood. The veins of the labyrinth, similar to the arteries, and drain into inferior petrosal sinus. Function of the inner ear. Convert mechanical sound waves to neural impulses that can be recognized by the brain for hearing or balance.